We have a returning guest today, Dr. Sheetal Siledar-Lee, a licensed psychologist in private practice who specializes in trauma treatment in a context of immigrant populations, South Asians, and the general community. We have a special segment today as part of Suicide Prevention Awareness Month in September. Today, Dr. Siledar-Lee will be discussing suicide prevention in the South Asian population and AAPI communities. Thank you so much for being on our show today and welcome.
Thank you, Jack. Thank you for having me here again. I would like to say that this is a very heavy and sensitive topic. So, people listening to this, if you need to take a break and attend to self-care, please do so. Again, just a reminder that we're talking about suicide in the AAPI community. We have a lot of statistics showing that suicide rates have increased drastically in the last 5 years, especially since the pandemic. A lot of people find it hard to talk about this topic, including providers, people in the field of psychology working with clients, find it really challenging when this comes up and tend to avoid this. There is a myth that talking about suicide increases the risk of suicide, and that is absolutely wrong. Like I said, it is a myth. Talking about suicide actually normalizes it. It gives people an opportunity to just feel comfortable and eventually open up and share if they are having any such thoughts or ideation. And as providers, I feel, we just cannot take it for granted. Any of our patients at any time are at risk, especially in the Asian community, in the AAPI community. There are a lot of factors that are making this more and more increasingly something that we are seeing with the community.
Do you suspect, do you have any suspicions in terms of why that might be, just in terms of your clinical work?
Sure, absolutely. One, a lot of male who actually go through suicide successfully. I don't like the word successfully, but who complete suicide, I would say rather, we have seen that there is a pressure. They are immigrants, there is a pressure to perform. The model minority myth that is associated with Asians, the challenges that are coming with that, the layoffs, high cost of living. Again, the entire, I don't think I want to limit to this to the Asian community, but in general, the stereotype that men are supposed to be strong and not express their feelings. So men bottle it up. And a lot of times we've seen that they use other coping mechanisms like gambling, addiction, alcohol use, which increases the risk of suicide.
Yeah, and I would say definitely in the AAPI community, there's this idea of stoicism and lack of emotional expressiveness. Just in general, our culture typically is a little bit more low context. Well, I mean, East Asian, which is different than, say, South Asian in terms of the social communication context. And one other, I guess, within this area of Suicide Awareness Month, and shining some light on this topic, particularly in the AAPI community, can you tell us more about what you like our listeners to know about?
Absolutely. I think, one of the things I would really encourage listeners to do is if you know of anybody, whether it's family or friends, to be more mindful, to be more aware about signs you're noticing, changes in behavior. There are definitely certain signs that we have been able to identify that are been in most cases of suicide are people who are contemplating suicide. So if you see that a person is really depressed, they're isolating themselves, they're kind of detaching from their relationships or belongings. They start giving away things that they like. They start cutting off relationships with people, close people like friends or family. Obviously, depression, low mood, other factors would be drinking, alcohol, substance of any kind, loss of job, not being able to work, financial or emotional stressors. All of those would be signs to monitor. If there are these signs and you're seeing significant behavioral changes, I would say that please try to talk to the person, try to seek help for them. And it is completely okay to go get help, even if you are or somebody you love is having suicidal thoughts. A lot of times people feel that they get institutionalized here. But sometimes you do need to be in care where you are restricted from the outside world and you are able to work on yourself and deal with these intrusive thoughts in a more healthy manner.
Yeah, I'm glad that you are also pointing out that if we see concerned family and friends, that this type of help isn't just isolated towards mental health professionals, that we all collectively should be engaged and involved in being aware of suicide as a topic. Because as you're talking about this, I also noticed some of my own biases, which is just
Mhm.
kind of recognizing that, oh, talking about suicide is not necessarily a natural conversation for AAPI folks. Whereas if I screen suicide all the time in my clinical care, but just in general, there's a little bit of bias that, given that most of the research, most of the interactions have been white folks, that it's easier to assess and
Mhm.
easier to have conversations about suicide with white folks. So
Yes,
yeah, just a little
absolutely.
reaction. Yeah.
Yeah, culturally, it's not something we talk about, right? Death is in general a sensitive topic. It is more easier to talk to the white folks and talk about, like, okay, what have you planned? How would you like things to be after you die? Do you have a will or a trust? But talking about the same thing with somebody in the Asian community can be considered very disrespectful and, really touchy, sensitive topic, because there is just a belief that if you talk about death, then you're wanting the other person to die or you're inviting death, those kind of things that are considered. So it is definitely hard culturally to talk about these things. But I would say that as providers, as people in practice, we see our patients for about an hour a week or maybe sometimes twice a week, but other people that are in their life see them more often, so they are able to pick these things up. So I think, as providers, yes, we screen for these things, but people in general also should be aware and should look out for these things in friends and family. Especially, I want to say, emphasize this, that parents nowadays should be doing this as well, because teen suicide rate has increased drastically since the pandemic. We all know that suicide and depression rates increased during the pandemic, and unfortunately, it still keeps going up. So, teen suicide is one of the biggest concerns we are going through. It's a crisis that we are going through right now.
So, Dr. Sheetal, any final thoughts?
I think my final thought is that I want people to be open to the idea of, assessing for suicide in the best way that they can, not clinically, but, look out for signs or symptoms in your loved one. If you feel anybody is going through such thoughts, get them help, support them, be there for them. A lot of times, these kind of thoughts or these kind of feelings come up, and it might be a cry for help. So please provide them that love and support and be there for them, and always seek professional help whenever needed. You can call 911, go to the emergency room, and get help immediately. So please help your loved ones, and also please take care and assess yourself. If you feel any of these thoughts, just reach out and seek help for yourself too.
All right. Well, thank you so much for your time today.
Thank you. Thank you, Jack.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.